swimming upstream that we're trying to fight this huge epidemic of obesity and sedentary lifestyles. We've done a better job of getting people to quit smoking. Costs are a huge issue. I mean, a lot of times we can't get some of the medicines we really think are ideal for our patients. Sulfonylureas in an elderly patient at risk for falls would be a perfect example of that because they're too expensive and they're not covered on a Medicare Part D plan, even though it might be the best. And if I had to do every time I ask my nurses to do a prior authorization, I get the most evil look ever. And then we have issues of adherence. Even when we get the right medications for our patients, a lot of times they're not taken. And he talked about the statin rates, and we've looked at insulin refill rates, and it can be actually abysmal. But despite all of that, let me champion a few things. Here's the U.S. death and age-adjusted death rates for cardiovascular disease from 1979 to 2008, and you can see the downward trend. This is a map that shows a percent decline in cardiovascular disease and death rates by the state from 1996 and 98 through 2005 and 2007. And you can see some of these darkest blue are 31 to 35% reductions, and the lowest are still 19 to 26% reductions. Emergency department visits for rates for coronary heart disease by sex. You can see male and female. We've closed a little bit of the gap there with male versus female. And then actual age-adjusted death rates for cardiovascular disease, actual and expected from 50 to 2008. And what they did is they drew the trend line of what you would expect if the trends had continued from 1970 through 75. And you can see that maybe over 1.1 million deaths have been averted over that time. Now, look, we've got a lot better medications. I understand that. We do have better catheters and intervention. But I will argue that this is us, you and me, statins, aspirin, blood pressure control, smoking cessation, physical activity, all the things we do every day, banging our head against the wall to make these patients' cardiovascular risks go down.